health journalist from Croaky, and we're coming to you live from the National Rural Health Conference in Cairns. And I have with me Trent Twomey, who just made a terrifically interesting presentation in one of the plenary sessions. So Trent, I'll let you kick off. Who are you and what do you do?
Sure. So I'm a pharmacist. My wife and I, she's a pharmacist as well. We own a group of pharmacies in North Queensland, and I'm the chair of the Northern Queensland Primary Health Network.
And what is that exactly?
So the PHNs were created by the Commonwealth Government nearly 24 months ago to be the successor organisations to the Medicare Locals. So there are 31 PHNs around Australia, and the footprint that I'm the chairman of stretches from Serena, just south of Mackay, all the way up to the Papua New Guinea border.
And you presented in the session that you've done a number of mapping exercises. I mean, you've mapped the health needs of the local community. So, well, you made the point there is no one community. It's a very diverse group of communities.
It is.
Can you give us a picture of what some of the health needs are that you identified in that needs assessment?
Sure. So the Northern Queensland PHN is larger than the country of Japan, but we have 750,000 people. So we're required, as all PHNs are, to produce a health needs analysis which gives a snapshot in time of the health of our local community. Now, for a country that large and a population spread across that large area, there is no such thing as Northern Queensland. So we are a variety of smaller communities of interest, and you know, to give weight to that, we have 31 local government areas, 31 mayors. So we think we're the most over-governed part of Australia. But what we've tried to do at the PHN to make that health needs analysis relevant to the consumer is we've tried to release a light version of the global HNA relevant for each of those local government areas. So people can log into it and go, what's happening in the Cassowary Coast, what's happening in Cairns, what's happening in Aurukun or Pompey.
And you did another sort of mapping exercise. You presented us with a number of different maps of the area that you cover. Can you explain the different maps?
Yeah, sure. So what we found in the health needs analysis is that the communities of Cairns, Townsville and Mackay are completely different, and in a lot of respects bear no resemblance or similarities to those communities in rural and remote Australia. And to illustrate the example, we use the remote Indigenous communities, but that is an extreme example. It's still, we have a lot of rural and remote communities that are not Indigenous communities that are having the same issue. So what I did was I tried to highlight the fact that the needs of Yarrawonga, the most affluent community in Townsville, are completely different to the needs of people that live in Yarrabah, an Aboriginal community. So if we look at the remote communities, they don't need another orthodontist or an audiologist or another clinical psychologist. They need a house, they need a job, they need strong family units, and this is what is the social determinants of health. So if we want to have any meaningful results in closing the gap in the Indigenous health aspect or improving those health indicators in our generic health needs analysis, we need to have an underlying focus on improving the social determinants of health.
And so to address the social determinants, you put up these maps showing that really we have these multiple layers of governance and they don't align. So can you tell us a little bit about
of course.
The maps,
so
how they don't align?
In Northern Queensland, we have an innate distrust for government. You know, Brisbane is an awful long way away, and Canberra's even further. And what we want to be able to do is to feel empowered to be able to take control of our destinies in a planning process. So the system of government, whether at a state or a federal level, is basically designed against us. So if you have a look at the boundary for the Department of Education and Training, you have a look at the boundaries for the Department of Transport and Main Roads, you have a look at the boundaries for the Hospital and Healthcare Services, have a look at the Queensland Police Service boundaries, you have a look at the Regional Organisation of Council boundaries, none of them align. So it's very difficult for discrete communities, and let's talk far North Queensland or North Queensland, the Mount Isa Townsville area, or the Greater Whitsunday area being Mackay, Isaac, Whitsunday, to have a conversation about where their communities are heading to help dedicate and funnel resources to local priorities that they're identified in all of those spaces. And if we want to address the social determinants of health, we have to address healthy communities, stronger local governance structures in local councils. We need to have a look at the clinical plans of our hospitals and healthers, but just as importantly, we need to have a look at the education plans in our Department of Education.
So practically, how do you propose to align all those different boundaries?
This is not a new issue. This was an issue that was raised by the Bligh government, and what the Bligh government did is they instructed all of the DGs of all the different departments to get in a room and nut it out and make sure they could harmonise all the different boundaries. But of course, if you're a DG, your job is to argue the case of why the world should exist according to you. So they all put forward their best arguments of why everyone else should change to match them. This needs to be something that the Premier takes the leadership in, that Premier and Cabinet takes responsibility before and says, these are the maps for regional Queensland, and all of your departments must adjust slightly at the edges to make sure there is alignment. So that way we can have a conversation in Cairns with the local director of education, the local director of the police service, the local director of the hospital and healthcare service, or the Department of Transport and Main Roads. So we can say, what do we want to do for Cairns and Far North Queensland? And that's what we need.
And what are the odds of that happening?
No. Well, the more we talk about it, and the more light and oxygen that we can give to this particular issue, it's one of these things where both governments of levels of government and of all persuasions are saying there is no new money. There's massive budget constraints at a Commonwealth level and the state level. You need to tell us how you can get better efficiencies out of the resources that we're giving you. And this is one common sense way that we feel we can get a more streamlined and structured system that empowers people in the regions to take control of their destinies.
So let's imagine that you have achieved moving that huge boulder or mountain, and we do have all the departments and services boundaries aligning, and so there is possibility for talking across silos and sectors.
Of course.
How do you see that actually improving a community's health?
Okay, well,
how might it work ideally?
So the needs of Townsville and Cairns are very different. The needs of Atherton and the Tablelands are slightly different to those of Mareeba, even though all of these communities are joined and are communities of associated interest. So what we'd like to be able to do is to be able to address the area. It's about prioritising need. So it's about locals being able to prioritise their needs in their community so they can direct the resources that are dedicated for their community to the areas that they most need. So for example, if there is a high unemployment rate, as there is at the moment in Townsville, Cairns and Mackay, is that a training issue, or is that a construction issue? Is that a building improvings issue? Is that an issue because Yarrabah only goes to year 11 and it needs to have year 12? If we want to address the severe disadvantage in the Yarrabah community, we need people to be in gainful employment. For people to be in gainful employment, the evidence quite clearly shows us that the higher the level of your education, the greater the ability for you to attract meaningful and long-term employment. People can't get a high school certificate in Yarrabah. So, if there is a finite amount of money, as there is, going to the community of Yarrabah, maybe a jetty, as is the political winds of today, spending $20 million on a new jetty isn't going to get us the best return on investment. Maybe it is introducing year 12.
Right. And has the PHN made a formal submission?
Of course we have. We've made a formal submission to the Palaszczuk, to the Premier herself, to the new Minister for Local Government who's just been appointed, to the State Opposition, but also to the Federal Minister for Health, and also the Federal Minister for Indigenous and Torres Strait Islanders as well.
And as you know, there's a sharing shed at this conference where the priorities from participants...
I haven't been there yet, so you've taught me something.
Okay, well what would be your nomination for the sharing shed? What would you like to see this conference say at the end of it?
I would like to see this conference make a recommendation to the Premier of Queensland to address the governance structures of her state's department to ensure that it enables empowerment for people in the regions.
Thank you very much for your time.
No worries, thank you.